Hi everyone, we're at Conneaut Lake Veterinary Hospital on 322 and I'm with Dr. Donny Consla, and we're going to be talking today about vaccinations and the importance of vaccinations. I know at the Bark Park we have a real issue with that because we require a lot of vaccinations and a lot of people are not aware of what vaccinations their dogs should have. So we want to go over that with you today and just give you somewhat of an idea. And Dr. Consla, what should we know about vaccinations?
There's lots of things to know.
Okay, good.
So first off, I guess let's just talk about what a vaccine is. And it's basically something that we can give that's manufactured in a lab that allows the animal's body to fight off infectious disease. So these can be parts of an organism. It can be kind of an inactivated organism or a killed organism with some different things mixed in there to help stimulate the immune system, and all of those, after that stimulation, allow the animal's body to make antibodies, which can fight off the infection for that specific disease.
Just like a human.
Yep.
I just got the flu shot.
There you go.
Same idea. Okay, same
Yeah.
idea. All right, now when we talk about vaccinations, there are some that are extremely important, some that the person has to get for their dog. My question will be as we go on today as to if I don't have a lot of money and I can't afford to get an awful lot of vaccinations, which are the most important ones for me to have. So let's start down through and talk about the vaccinations. What is kind of an overall view on this?
Okay, so it's basically split into two camps. Core and non-core is kind of what we use in the veterinary field. But you can also kind of think of them as essential vaccines and lifestyle vaccines.
Okay.
So the core vaccines are the ones that every dog should have, regardless of its lifestyle, regardless of where it's going, so on and so forth. And there's two main vaccines.
All right.
The first is rabies, and this is huge. For dogs, this is required by law. To have a dog, you have to have a rabies vaccine. And rabies is what we call a zoonotic disease, meaning that it can be transferred from animals to humans. So aside from just protecting the dog, this is a public health type of thing that we're doing here.
Can that only be transferred by a bite, or is that just transferred because I come in contact with the dog?
It's in the saliva, so
Okay.
Usually it's a bite because there's a lot of saliva in the mouth, and when you get a bite, it's transferred that way. So huge public health thing. We know we have rabies in the area and wildlife around here. The big vector species, of course, is raccoons. But that can be transmitted to dogs, coyotes, cats, livestock like cows, horses, things like that. So absolutely essential.
Okay, and when is that first given and how long is it good for?
In Pennsylvania, the first rabies vaccine is given at 12 weeks of age.
Okay.
And then that vaccine is good for 1 year. So it's boosted again in a year, and then it's good for 3 years. And every time it's boosted, it's good for 3 years from there on out.
So every 3 years I've got to have my dog vaccinated towards rabies?
Unless it's the first time, and then it's 1 year.
And at 12 weeks of age?
At 12 weeks of age.
Okay, that's an easy one. And also I get those same bulletins I'm sure that you get from the Department of Agriculture, and that we get them from Pennsylvania Department of Agriculture. And they're always telling us where they have found a rabid animal of some type, or a cat, or whatever it could be.
Yeah.
Okay.
And there was a case of a woman, I think in Montana recently. She actually passed away from rabies. So, it's still out there. In lesser developed countries, it's a huge problem that have a big feral dog population. So,
how would I know if my dog or another animal that I'm seeing out at my place is possibly infected with rabies? What do I look for?
First, exposure. So if your dog got in a scrap with, a raccoon or something, then that's always have it on the table. The other thing to watch for would be neurological signs. So weird changes in behavior, seizures, head pressing into the wall, blindness, any type of neurological thing. Or even, just vague illness after an exposure situation.
Sometimes I've been told that a lot of animals that carry rabies are nocturnal. So they're normally not out during the day.
Right.
And I think that I've often said, I think I had that with a groundhog one time, or a raccoon or something, and I remember calling, maybe down here, or calling someplace and saying, I think I have an issue. Someone's got to come and take care of this because I've got a raccoon or something that is just sitting there in the middle of the day, and
Yeah.
that's usually a pretty good sign that something's not right.
Right. If the wild animal is not acting like you would expect it to, normally if you saw, like a skunk or something, it'd be startled and run off. But if it hangs around and is like wobbling over towards a building or something, something's probably not right there.
And is rabies more of a concern to those of us that live more in the country than those in the city, or equally to both?
Probably equally to both. If you think of, the city environment, there's more, things are more densely together, there's more garbage and stuff all in one area, which attracts more raccoons, skunks, things like that carry it. So I don't know if it's any different city versus country.
Okay, so we've got the core vaccinations. What's the next one?
The other core or essential vaccine is actually a combination vaccine, and you'll see it abbreviated as DHPP, which is distemper, which is a virus, canine infectious hepatitis, that's the H, parvovirus, and parainfluenza.
Should my dog or my cat be vaccinated towards those things? Do cats get vaccinated towards those two? DH?
No,
okay.
Different things.
Just dogs. Okay,
Yeah.
let's talk. We better stick with dogs, we'll be here for days. Okay, so I should vaccinate my dog towards those things also.
Yeah. And that's going to start around 8 weeks of age. By that point, the puppy's maternal antibodies have worn off. If you give a vaccine before then, the maternal antibodies will attack the vaccine that you gave, and so it's kind of ineffective. So we start that around 8 weeks, and the goal is to have, regardless of when you start it, we want 2 doses of that after 12 weeks.
And how far apart?
3 to 4 weeks.
Okay. Now, let me ask you a question. I always come to you or someone down here to have my dog vaccinated. A lot of people don't do that. A lot of people go to a retail place and buy the vaccinations. Is there an advantage one way or the other, or is it okay to do that, or why should I maybe consider the veterinarian as opposed to a retail store?
The advantage for the veterinarian is there's kind of 2 big things. One, we can guarantee the shipping and handling of the vaccine.
Okay.
If those vaccines aren't stored at the right temperatures, say in the semi-truck, then those components inside can be deactivated and then aren't effective. So we know that the shipments that come to us are at the right temperature and so on and so forth. The other big advantage is that a lot of problems that puppies have, we can pick up at those booster visits. So things that are just starting to emerge, we can pick up before they become a huge problem, and things like that.
Okay, so here I am, the breeder, and I have 4 dogs, but I always come down here. But I think a lot of people that have multiple dogs often do their own vaccinations. That's pretty common, especially in this area, especially farm animals. Because if you're there with a whole bunch of dogs or a whole bunch of whatever, then you tend to get to at some other place. Is there any question you should ask the place that you're getting them, retail stores, to make sure that hopefully I'm getting the right ones or they're effective?
Yeah, you just want to make sure they have, the right components in them. That's the big thing. Some of the combinations out there might have things that we don't really need to vaccinate for. For example, coronavirus, that's something that used to be vaccinated for regularly, and it was part of kind of this core protocol. But through lots of research, we found that the type of virus that this coronavirus is, it mutates really easily. So vaccinating for it is basically just a waste of money, because by the time your dog gets exposed to that specific virus, it's already going to be mutated slightly from the version of the vaccine that we gave.
Okay, so I should be doing rabies, and now I'm going to do tell me those letters again.
DHPP, distemper, hepatitis, parvo, parainfluenza.
But sometimes up at the dog park, I get a report from a veterinarian's office, and it's not that easy for me to read. It doesn't have those 4 letters. It has other things. Is that because there's different manufacturers?
Yeah, so there's several large manufacturers of vaccines, and they all have different names for each of their vaccine. So we have something called Duramune and RDAP, and those are like the names of the vaccine. It'd be like Prilosec, which is like a heartburn medication, versus omeprazole is the drug name.
Okay, gotcha.
So that type of thing. Or Benadryl versus diphenhydramine. So it's got like the trade name on it.
Okay, and how often do we have to do this DHPP? Did I get it right?
Yeah, you got it.
DHPP, how often do we have to do that?
So starting around 8 weeks, 2 doses after 12 weeks, and then they're good for a year, and then it's good every 3 years.
Oh, okay, every 3 years. Okay, gotcha on that.
Yeah.
All right, so now we've talked about the core and the non-core. What are there other non-core vaccines?
Yeah, so there's one that's kind of in the middle, and that's leptospirosis. And leptospirosis is a bacteria that's spread in the urine of wildlife. And in some areas of the country, like geographically, it's considered a non-core vaccine. But just given our area, our location, we know we have lots of wildlife around here, so we consider it a core vaccine because our animals, our dogs, are exposed to more wildlife than, say, dogs in Los Angeles.
Okay, so now I've got the rabies, and now I've got the DHPP, and now you're telling me I've got to do this lepto.
Uh-huh.
And how often do I give that one?
That one, also, the puppy has to be 12 weeks.
All right.
And it's 2 doses, so 1 at 12 weeks and then 1 in 3 to 4 weeks.
And how long is it good for?
And then it's good for 6 months to a year, depending on lifestyle. So if you have a hunting dog, if you go hiking all the time, then I would say get it every 6 months. If you have a lap dog that you take outside on a leash to go to the bathroom, once a year.
Okay, and that's an interesting comment because a lot of people say to me, my dog doesn't go outside. My dog goes out to do its business and comes back in, doesn't have contact with any other dogs. Do I still have to do all these things?
Yeah. The question I always ask is, well, do you ever see a squirrel in your yard? Or does any wildlife ever come into your yard? And certainly, even if you're in the city, the answer is yes, you know.
Okay.
We're fairly rural, so there's wildlife everywhere. So unless you can prevent stuff from coming into your yard, then there's still that potential exposure when you take your dog out, even if he's on a leash.
All right, now I'm at rabies, I'm at DHPP, I'm at lepto.
Yeah.
What's next?
And that's the core stuff.
That's the core.
For this area.
Okay. There's another one I want to talk. Yeah, there's 2 other ones that I want to talk about, but I think you'll probably cover them. So what's the next one?
So the non-core, these would be like the lifestyle vaccines. So depending on your dog's lifestyle dictates whether or not your dog actually needs these vaccines. So the first is Lyme vaccine, and that's for Lyme disease, just like people get, spread by ticks. And as you know, the ticks have been really bad this year.
God.
It's amazing how many ticks we've seen just since
And the groomers are seeing them too.
Yeah. And it's just crazy. And lots of positive dogs for Lyme disease, anaplasmosis, these other tick-borne diseases that we'll talk a little bit more about, but it's kind of scary. So Lyme disease we usually recommend for, again, dogs that are going to be, you know, outside a lot. So hunting dogs, dogs that do a lot of, you know, hiking, walking outdoors, running through tall grasses a lot, you know, just if you have an unmowed field behind your house, you know, something like that.
So get the Lyme disease. Okay, question. How often do I get it?
That is every 2 to 3 weeks.
And how long is it good for? Just
that one's good for a year.
Okay, good. Okay, what's next?
Kennel cough.
This is my favorite one. This is our biggest problem at the dog park.
Yeah.
People who don't have do the kennel cough, and they say, "What's kennel cough? What's the other name for it?
Well, so kennel cough is kind of like a broad disease term. There's actually several different organisms that can cause what we describe as kennel cough. So Bordetella bronchoseptica, that's a bacteria. There's some parainfluenza viruses that can cause it, and different strains of parainfluenza viruses. So the vaccines that are out there for kennel cough, you really have to look at the label and see what all they cover. All of them probably cover the bacteria and at least one of the viruses, but some of them cover more strains than others.
How would I know that?
You'd have to look at the label of the vaccine.
Or ask the veterinarian.
Or, ask the vet.
Okay, now we require this. Why should the bark park be requiring that?
So the big risk factor for kennel cough is dogs in larger numbers that are in close proximity. It's spread, you know, by coughing, respiratory secretions, and in an environment like a kennel, boarding facility, even, you know, just dogs playing together in the pens, they're at higher risk for that because they're in such close contact.
We don't take any dog even in grooming because they're in close proximity there, or any dogs in the kennel unless they have Bordetella. Not real popular with people because they say, well, my dog doesn't have to have that. And I said, well, they do, and we wouldn't even let the dog in the door for daycare or anything unless they have that.
Yeah.
And how long is that good for? There's 2 different ones there. Is there one that's good, or some people say, well, I get it every 6 months, and some it's for a year.
That one's kind of like the lepto vaccine. So based on your dog's lifestyle. So if your dog is going to the dog park, if they're going to the groomer monthly, if you travel a lot on business, or go on vacation a couple times a year, every 6 months, because your dog's going to be in the environment with the potential for exposure more frequently. Okay. If you maybe take your dog boarding once a year, or get them groomed once a year, then once a year vaccination is probably fine.
I have a little Shih Tzu whose name is Tyler, and I always vaccinate. In fact, I probably over-vaccinate because I don't want to deal with the alternatives. And he got kennel cough, and he was vaccinated. And it was because it was a different strain or something. That also happens because all of a sudden I had this hacking. Yeah. And I came down here and I said to Dr. Wade, okay, I think we've got an issue here. I thought he had heart trouble because it sounded like that congestive heart coughing. And she said, that's perfectly fine. He's got kennel cough. And I said, but I was just here not too long ago. And I got it. So they can still get it,
right? And so
even if they're vaccinated.
Exactly. So like with kennel cough and lepto is another good example. We vaccinate for the most common strains, but there's still other strains out there. Like with lepto, there's hundreds of other strains out there, but we vaccinate for like the 5 most common ones that the dog could potentially be exposed to. And I should mention that leptospirosis and technically kennel cough, a component of it, are also zoonotic like rabies.
Oh, okay, I didn't know that.
Kennel cough we really only talk about with like immune compromised people getting it, but lepto, anybody could get.
Well, and we're going to talk about the reactions that dogs sometimes have, but sometimes an older dog sometimes has that cough that sounds like kennel cough, but it actually could be congestive heart that sometimes is associated with this. That same hacking, isn't it, where they just, or it seems like they're clearing their throat or whatever.
Yeah, it's really like a moist cough type of thing. Right.
So again, run to the veterinarian, as I always do, and find out what's going wrong here. Okay, what are some of the reactions after I give all this? I mean, I had one collie, and I was in here. This has got to be 10 years ago, and I'm waiting to check out, and I said, oh my God, look at his face. And his face, and a collie, I mean, he's got a brown nose and all that stuff, and he's got some reddish blotches that's starting to come out. And I said, you got to be kidding me. What in heaven's name is wrong? And he was having a reaction to something. So I think what we did then, I think we gave Benadryl. And then I think the following year, I think we gave him Benadryl before we gave the shot. And he was down as always having a reaction. So what are some reactions that a dog can have after the shot?
So the most common thing is a little bit of lethargy for like the rest of the day. Just their body's kind of amping up, responding to these antigens that we've given, making the antibodies. It just takes a little bit out of them. So you might notice your puppy is like a little more tired. In an adult dog, we usually don't see that tiredness afterwards. A little bit of tenderness around the injection site is also common, especially in smaller dogs or puppies. Just like people, you're getting an injection, so it's going to be a little tender. And sometimes, more so with the rabies, we can see a small localized tissue reaction. It almost seems like a little mass, but it goes away over a few weeks, and usually isn't anything to worry about. So that's kind of like the common side effects, if you will, of a vaccine. The more serious reaction would be the anaphylactic reaction, like you were describing with your dog. And think of like a person who's allergic to bees or something like that. Facial swelling, hives, acute vomiting, collapse, pronounced lethargy, pale gums, all of those types of things. And that's because they're actually allergic to some component of the vaccine. So this type of reaction is going to happen at the second dose of the vaccine that they're allergic to. So let's say, for example, the dog is allergic to the leptospirosis vaccine. We give the first dose, they're totally fine. It's just like a person who's allergic to bees, they get stung by a bee once and nothing happens. That primes the immune system, and so the next time they get stung by a bee or the next time we give that leptospirosis injection, then they have the reaction to it because their immune system's already been primed to it and has made these antibodies to react with that vaccine or whatever it may be.
Okay, another question. Where do you give the shot? I mean, sometimes I see you give it, some you're giving in the butt, some you're putting in the neck or in the skin to hold the skin up, and the other one we need to discuss is what about the one you're sticking in that poor dog's nose?
So we give vaccinations in different locations. So if there is like a localized reaction or something of that nature, we can say, oh, it was this vaccine. So we give rabies over the right rear leg. We give...
Really?
Yeah.
Okay.
Which is easy to remember, right?
Sure, rear, right, okay, got that. Rabies, that's easy.
The DHPP goes over the right front shoulder. The lepto goes over the left front shoulder, and the Lyme goes over the left rear.
I never thought about that. Okay, now what about the ones you're sticking in the nose?
And
which one's that?
That's one of the forms of kennel cough that we can give. So we try to give that one to most dogs because, like I said before, kennel cough is spread by respiratory secretions, which means they're inhaled through the nose. So if we can provide local immunity at the nose, that gives us better protection.
Does that one through the nose protect as long as the kennel cough that you're doing as a shot?
Yeah.
Okay.
It's the same.
And then I had a problem. With 4 dogs, I always have some issue. My Shih Tzu, he can't handle it.
Yeah,
because he's got no nose.
Right, the stenotic nares.
Right, and some dogs can't handle the nose, so that's when you decide on the shot.
Right. If it's too stressful, or they have narrow nostrils or whatever it may be, then we can go to the injection.
Some of my dogs, when they get their shots, will run along the floor with their head against the carpet. For whatever reason, he goes around in circles. We always laugh after we're giving all the shots because he's having this crazy reaction.
Yeah.
And that's the immediate one that we sometimes get. Okay, what about, so we're done with the vaccinations.
Yeah.
Okay, and if I only can do 2, I want to do rabies and lepto.
Rabies and DHPP.
Oh, I got confused. DHPP.
Yeah, and lepto. Those are the essentials.
But what if I can only do 2? Then back to the rabies and the...
DHPP.
Okay, so we got that. Because some people can't afford it, bottom line. Rabies clinics, you have them.
Yeah.
A lot of different veterinarians have it. And you can go there, and I noticed whenever I was down in the animal hospital in Meadville, and it's been here and several other places, here's of these people who come in with all their dogs. Now, do you think that means that that's all they're vaccinating them for? If farm animals, maybe just rabies? Is that why they're bringing them dogs here? Because they could come here and get all 3 of them.
Yeah. Usually those animals, I don't want to say usually, but if they're coming to the rabies clinic, the only one they're getting that day anyway is the rabies vaccine.
Okay. All right.
So some people will, come into the hospital for the other vaccinations and then just save a few bucks with the rabies and get it at the rabies clinics.
Okay. All right, so let's go on to what else we're going to do. So we've done the vaccinations. I've already spent probably a little bit of money, a little bit of cash, especially with 4 dogs.
I should say that with the reactions real quick, there are newer vaccinations out there that are called recombinant vaccines, and those are less prone to reactions because they kind of have less stuff in them. And almost all the vaccines that we use here anyway are those recombinant vaccines.
Okay.
So they're a little safer and more effective.
Okay, so we're done with the vaccinations.
We're done.
What else should I do with my dog?
So some other wellness stuff we'll talk about is heartworm disease testing.
Okay.
So heartworm disease is spread by mosquitoes, which, as you know, we have a lot of around here.
Yes.
And the infected mosquito will bite the dog, transmit some very small larvae into the dog's bloodstream. That larva will go through some different changes and eventually end up in the blood vessel that connects the heart to the lungs. That's where it wants to be. It grows there, it reproduces, and that blood vessel is only so big, so it gets backed up and starts filling up the heart, and that's why it's called heartworm disease.
Gotcha.
So heartworm disease is very easy to prevent, but very dangerous and very costly to treat. So for those reasons, that's why we kind of push the regular testing and the preventative so much, because if a dog gets infected with heartworm, there's a lot more risks involved.
We hear about that occasionally.
And we do see it up here. It's not as bad as, say, like the deep south where they have even more mosquitoes, but we do see it in this area from time to time. So the testing consists of a small blood sample, 3 drops of blood. Takes about 8 minutes to run. We can do that in-house and get some results for us that way. The nice thing about that test is it also screens for the tick-borne diseases that we're seeing a lot more of. So within the past few months, dogs have been coming in for their regular wellness. They have their heartworm disease test just so they can stay on their prevention, and they've been coming up positive for all these tick-borne diseases just because the ticks are so bad this year. So that's a real added benefit of that test, is that we can screen for those tick-borne diseases as well. The reason why we require the heartworm test to be performed before we dispense any prevention is if a dog already has heartworm because it was never on prevention before, or maybe somebody forgot to give a dose, or nothing's 100%. If they have heartworm and we give the prevention, there can be some serious side effects. So we always like to make sure a dog is negative at their annual wellness visit before giving the prevention.
So every year now I've got to make sure whenever I come in for the wellness exam and I'm getting some of these other shots, but then again the shots could be on a 3-year cycle, so I'm really not stopping for shots. Mm-hmm. But now I need, if I've got heartworm, to come in and have that test done.
Right.
Do I have to give heartworm year round?
Yes.
They used to say no. They used to say whenever the mosquitoes died I could stop.
Not the case.
Now we're saying 12 months.
Right. So they've actually done a lot of studies with this, and two interesting things have come out. The first assumption was if my dog doesn't go outside or goes outside very little, then he's not going to be exposed to heartworm disease. Well, this one study was done and it found that like over half of the dogs that were diagnosed were those like strictly indoor dogs. So I mean, if you just think about it, how often is there a mosquito in your house?
Too often.
In the the summer or whenever, and you're sitting there reading a book and you hear this like buzzing in your ear, and it's a mosquito. So if a mosquito's in your house and biting you, it certainly can bite your dog as well.
But not all mosquitoes carry the infection. It's just we're into heartworm. It's not all mosquitoes that have it.
Right.
It has to be an infected mosquito.
Exactly.
Okay, gotcha. All right.
And so that's kind of the one thing. The other reason is so from a baby heartworm to an adult heartworm is about 6 months. So let's say a mosquito comes into your house at the end of the summer, even early fall, because they're still around then. Mm-hmm. Bites your dog in September. September, October, November, December, January, February is when your dog is going to start having clinical signs of heartworm disease. That's the middle of winter. So if they're not on prevention year-round, then a bite early fall, late summer could still produce heartworm disease in the middle of winter.
Okay, can I get that anywhere, heartworm?
That one is a prescription, so it has to be at a veterinarian.
Okay.
And most vets will only dispense it if they've had a negative test.
Mm-hmm. So now we've got to do all that too. Mm-hmm. So now I'm into my vaccinations and now I'm into my heartworm. Mm-hmm. We're really chalking up a bill here. That's what this is what we always say if you're going to have a dog.
Right.
And we talk about the cost of a dog. Yeah. Trust me, this is part of it.
Right. And the thing here is that, it's like the old saying, prevention is the best medicine. There's reasons, just like in people, why we do all this stuff for your dog, because all of these diseases are very severe. Let's look at parvo. If you have a puppy and it gets parvo, easily over $1,000. Mm-hmm. And that's like not even a guarantee that it's going to make it through. Versus, a few vaccines that total maybe $60, $80. The difference is huge. Same with heartworm disease. Prevention for a year is, I don't know, maybe like $120 or something for a small dog. Mm-hmm. To treat heartworm disease, again, easily over $1,000.
Okay, so I get those little stickers. I put them in, but you know what happens? I forget. Mm-hmm. And I don't open up my calendar, and I forget that on the 1st of the month I'm supposed to be giving heartworm, and I haven't done it. Mm-hmm. What do I do? Give it right away, or do I wait till the 30 more days?
I would give it right away.
Give it right away. And okay, so let's say I'm giving it on the 1st of January, and I forget. It's been due on the 1st of February. I miss it. I find it on the 15th. I've forgotten.
February 15th?
February 15th. It's been 6 weeks. I'm 2 weeks late. Give it again. What do I do now? Am I now in the middle of the month as a regular basis? I don't go back on March 1st and give it again.
Right. It's 30 days from when you last gave it.
All right. Because some people, I think, say, well, it's always the 1st, always the 1st. And then they get screwed up and they put it in there on the 10th and they think, well, I'm on the 1st.
Yeah.
I've got to go back and give it on the 1st. Mm-hmm. Okay. Can I split any of these things whenever I'm giving them?
No.
Oh, I can't give half to two dogs, split one. People do that.
Yeah.
People break them in half and say, well, if I got this pill here and it says weight from 20 to 40 or whatever, if I've got two 30-pound dogs, why can't I split it in half? Mm-hmm. Not supposed to do that.
It just doesn't work that way, the way the drugs distribute and everything. So, I mean, in that situation, you're kind of just wasting your money because it's probably not going to be effective.
See, I think about what I know people do, because people tell me this. Well, and people do that. We'll talk about flea and tick, but a lot of people do that with flea and tick, the ones that you put down the back, and we can talk about the other ones now. They say, well, I get a tube, and I use it on 4 dogs. Instead of, here's how it goes. I've got 4 15-pound dogs. Okay, that's 60, but I can buy that big tube that is for dogs over 50 pounds. Can I just go and divide it up myself? No. That's what they do. Okay. Well, you want to tell people they shouldn't be doing that.
Yeah, I mean, in that situation, like, you can't, unless you calculate it out and have, you know, some special equipment, you can't guarantee that your dog is getting a full dose to actually prevent things. So if your dog gets fleas, then, you know, is it because it didn't have a full dose to actually protect it, or was there some other factor? You know what I mean?
Okay, one other quick question now. If you got that flea medicine is good, and we'll talk about that in a second, but that's good like for dogs under a certain weight and over. My dog's right on the break line, maybe 25 pounds, and Tyler and Roscoe weigh like 22. But they get the one that's for the 50-pound dog. Do I really have to put all that flea and tick on them, or can I, if I don't get it totally out, is that okay? Because
the whole tube.
The whole tube.
Yeah.
Oh boy, you're really... Okay, let's talk about flea and tick. Anything else about heartworm? Are we good on that?
Regular prevention and annual testing is the biggest thing.
Okay, I don't like that.
The other benefit of the prevention is it also prevents against gastrointestinal parasites, which we're going to talk about more in a little bit. But so it's just an added bonus. Again, several of those are zoonotic, which means you can get them. So especially people with little kids, people who may be caring for older family members, you know, it's just an essential thing, because again, it's not just an issue for the animal; it's a public health issue.
Okay. We better get past this. Let's talk about something better. How about flea and tick?
Okay, that's pretty easy.
That's easy. I know that.
Monthly prevention.
And that's the squirt on the back.
So there's 2 types. You can get the topical, which is like the squirting on the back.
That's the most common one.
That's the most common. And now they're making some oral tablets too. So like the heartworm prevention is a little treat that you give. And now they make some flea and tick prevention.
Does that work?
Yeah.
I was down here, people are asking about that, because that's only been, what, in the last year?
Yeah,
year and
around
a half?
there.
And I remember I was down here one day and I saw Dr. Becky Stanton on something, and I thought, aha, here's my chance. And I had her tell me the difference. But now there's a different one too. If my dog does a lot of hunting and stuff like that, isn't there, what's this collar deal?
Yeah, there's some new generation flea collars. You know, usually you hear flea collar and you're like, oh my gosh, like that's not going to do anything.
It was the old Hart's Mountain, remember that?
Yeah.
It was really crusty,
like
and it was white, and it was like powdery.
And it didn't do anything.
No.
And but now the same types of compounds that they're using in the topicals and the orals, they've put in kind of these slow release collars, and they do seem to work pretty well. We've got several clients that use them and really seem to like them. And they last for 6 to 8 months, depending on like how wet they get, basically. And they do fleas and ticks. They have kind of I think it's like a 13-pound breaking point or something. So they make them for cats too. So if your dog or cat was out in the woods and it got caught on like a branch, they could easily break free from it. So there's no worry about, you know, strangulation or anything like that.
Well, I always worry about that one. Again, I've got short-haired dogs that go to the groomer, and I have my long-haired collie, and I don't like whenever I put that, what is it, Vandix 2 or something that I'm using, and it looks like it's got, because I'm never really good at it, I pull up the fur and I hit it against the skin, but it seems to have a little bit of a residue. And being therapy dogs, I don't like that.
Right.
So I've been talking to Dr. Becky Stanton about that. I think I may go to the pill.
And that's why I think most people that use the oral formulations, that's why. They have like little kids or therapy dogs, and they don't want them touching that you know, greasy spot that's left over, and that's a legitimate concern, you know, because kids are putting their hands in their mouth and so on and so forth.
Now you said something else. What about the dock diving dogs? What should they be on? Because they're in that water maybe every weekend.
Yeah.
Is there certain types of flea and tick stuff that they should be using that is a little bit different for a dog that does a lot of that? Or people that have ponds on their property, or people that live near the lake, those dogs, you can't keep them out of the water. Are they just blowing the money to the wind whenever they keep on using this, or?
No, there are formulations that are waterproof. So like the Advantix 2 that you're using currently, that is a waterproof version. So dogs that are in the water a lot, swimming in the lake, whatever it may be, it's not going to get stripped out of their system.
Okay.
So waterproof does not mean soap-proof, however.
Oh, so the groomer is another issue here.
So, or just bathing at home. So a lot of
Okay.
times I'll see, like, oh, I put the Advantix on, a week ago, but he's got fleas already. Turns out in the middle of the week, went to the groomers,
Right.
and everything got stripped out. Because those topical ones just stay in the oil glands in the dog's skin. They don't, go all over the place. And so they can easily be washed out. So if your dog gets bathed frequently, or, dog goes and jumps in the nasty pond scum middle of the month, there are certain shampoos that are labeled not to strip those compounds out of the oil glands in the skin.
So solve all that problem and consider going to the tablet.
Or you could do that.
That'd be the better way to go, especially if the dog does a lot of dock diving or a lot of swimming in the lake in the summer.
Yeah.
Or, well, most of us, I think, that do the grooming. I think most grooming is done every 4 to 6 weeks.
Yeah.
So you could conceivably, but this is, here we laugh again. I've got all these calendars, and I don't know who gets it here, I try and keep them together, and then I get all mixed up. So, okay, so we've got flea and tick prevention. All right, now let's get the favorite one, the fecal exam.
Oh, yes. Are you going to demonstrate your little tinfoil technique?
Well, yes, I am, because I'm very good at this. I bring mine down in tinfoil. And who was the person? I was talking to one of your receptionists out there, or maybe it was one of your assistant business managers. And we were talking about how much I need. This is the biggest joke among dog owners. How much poop do I need to bring to you?
So 1 gram, or about like the size of a quarter $half.
So I don't need a half a cup.
No.
And people do that.
We get impressive amounts
Large
of
amounts.
feces sometimes, but we don't need it all. I mean, it's generous, but we don't need that much.
But all you well, there might be a reason they're giving you that much. But it's basically the size of a quarter.
Yeah.
Okay, and then I generally, and we'll talk about something else too. See, I'm getting all my questions with 4 dogs answered here. What about, I usually have foil, and then I just follow them around the yard, which is sometimes hard because mine go out at 5 o'clock in the morning, so I have no idea who has done what, where. So I try and get it, and then I put it in a piece of aluminum foil, and I close that up. Now, if I do it in the summer and I'm not going to get down right away to bring the sample down, does it matter if it sits for a while?
Oh, it does.
Okay.
So some different types of organisms can start to grow in it that aren't necessarily bad for the dog.
Okay.
So the fresher the sample, the better. If you know you're not going to be able to get one right before your visit, put it in the refrigerator. The most recent one you could get, put it in the refrigerator.
That's why I use aluminum foil, because I can close that up and I don't have to worry about that odor going into my refrigerator. Okay, now another question. If one dog has worms, do they all have it in my house?
Chances are probably yes.
Can I just bring one sample, or do I have to come down here with 4 labeled? A, T, R. I'm like a crazy person when I come in here. I've got everything labeled as to what dog it is. Can't we just mix them all together?
Like in one foil packet?
In one foil packet, or can't you just do one test? Or
well,
do I have to bring separate ones for all 4 dogs?
That's the ideal situation.
Okay, I figured. I knew that you were going to say that.
Yeah. Again, a lot of it comes back to kind of the life cycle of the parasites. If any animal has had an infection, for a few weeks, then we'll see eggs on our flotation. But puppies is a perfect example. So a puppy comes in for its first visit, they bring a fecal sample, and we don't see anything. And so we say, okay, good to go there. We always like to have 2 negatives, okay? So they come in for their next booster visit, they bring us another fecal sample, they say, you know what, he's been having some loose stool, we tested today, it has, hookworms or something. And they're like, well, why didn't you find that last time? It's like, well, the life cycle of that parasite, it takes so long for the worm to mature in the gut and to start producing eggs that we can see on the flotation in microscope.
Okay, what are the different types of worms my dogs can have?
So around here we talk about roundworms, hookworms, whipworms, which is more prevalent around here than some other areas. Tapeworms, those are kind of the worms. And then we have...
Can I see them in the poop?
Sometimes, yeah. So roundworms will look like spaghetti, tapeworms will look like little grains of rice, and those are usually associated with fleas or like a cat that hunts a lot, something like that.
Okay.
You can usually see whipworms too and hookworms, but they're a little smaller. And then we also can look for coccidia, which is a protozoa, and some other types of random protozoa and things like that.
And what's the general treatment for my dog if they have worms? Is it different for different types of worms?
It is, yeah.
I could be in trouble. I could have 4 dogs with 4 different types of worms with 4 different types of treatment.
You
We're
could. That
confusing
could
this here.
happen.
Okay. What's the treatment generally for the worms?
It depends on the type of worm, which is why we like to do the fecal flotation or centrifugation is what we do here, because it tells us that it's this type of worm, so we can use the most effective type of medication. There are, you could just give something and be like, if you saw a worm, you could just try one, but it may not work. So it's better to find out exactly what it is so you can get rid of it the first time.
Coccidia, that's another, see, here I go. This is like the story of Sue's dogs and their worming issues. Tyler had coccidia. Not real common, but they found it, and that treatment was different. That was, he was on pills 14 days or 21 days.
So because that's a protozoa and not a worm, it's going to have an anti-protozoal versus a dewormer.
Oh, Lord.
Yeah.
And then we always have to retest these dogs after they've been on the medicine for
to make sure, yeah, we got it. Okay. And then, after we get rid of that initial thing, if you put your dog on heartworm prevention, they won't pick up any of those in the future, except for maybe the tapeworms.
What about the coccidia?
Well, they could pick that one up.
Oh, okay, because I'm going to say
the most common ones, though, the heartworm preventions.
We're pretty good then.
Yeah, have preventative against.
Okay, so here we go again. Don't have a lot of money, and I don't know what I'm going to do here. What should I do as far as the worm? Should I do this all the time? Should I try and make sure I bring a fecal in all the time? Every year?
We recommend it once a year.
Once a year, okay. All right, now, can we go back just for a minute to the vaccinations, because I wanted to ask you this. An older dog, if my dog is 14 or 12, 14 years of age, and they're due for all their vaccinations, is it necessary for me to give them? And what's the other test that people sometimes do indicating that their dog has been over-vaccinated? That's called
titers?
Titers. Tell us about that, and tell us about when I need to do it if I have an older dog that's 14 and looks like he's getting very, very close to the end of his life. Do I have to give him all these vaccinations?
So titers don't tell us about so much over-vaccination. They tell us about the protection that the animal still has.
Okay.
So, people can get titers, too, for different things. Like, I have to get one every so often for my rabies vaccine to make sure I'm still immune against that. So,
you personally? Okay.
Yeah.
Gotcha.
True story.
I know. That was a good one. I never thought of that.
So, for example, some dogs have immune-mediated disease, like immune-mediated anemia or low platelets from immune disease, so on and so forth. And for those animals, we don't know exactly what the triggers is. It could be certain medications, it could be just an unknown cause, it could be something they were exposed to, it could be vaccine, we don't know. So a lot of times we'll say with those dogs, they shouldn't have any vaccines. But owners might be like, well, is he still protected? Can I still go to on walks or whatever? Can he interact with other dogs? That's when we'll usually talk about the titers, or like cancer patients, that type of thing, where immune status is a concern. The immune system's not top-notch or needs to be protected. So we draw a blood sample, we send it off to the lab, and they can determine how many antibodies that dog still has against that particular pathogen. And if it's above a certain level, that means they're still protected.
Is it possible to over-vaccinate a dog?
Yeah.
It is?
There probably aren't really any
great studies on that or anything?
Well, there's not really any big consequences from it. It's just more of a waste of resources, and you're not really adding any additional protection. Okay. So that's why we have like the established series of this many vaccinations for this particular vaccine, because we know that gives us the protection we need without doing excessive vaccines but still getting that protection.
I know a question. Whenever I come in here, you were making fun of me before with the aluminum foil that I bring all the poop samples in, but I can't get it out of one of my dogs, and I'm coming in here. Can you get a poop sample here?
I can.
Do you? Sometimes?
Sometimes.
And how's that done? Is it done
rectally?
Rectally?
Yeah, with a finger.
Okay. And is there also another, just a finger to get it?
Yeah.
Okay.
There's fecal loops too that we can use. We'll use that in like cats or smaller dogs, just because it's uncomfortable to have a finger.
So you do that to get a sample, and remember, it's only as big as a quarter, so you're not trying to get a cupful.
Yeah.
Okay. What else? Is there any other tests that we should add to here or anything else?
So everything we've covered so far is kind of just the, adult dog wellness exam. We talked about some puppy stuff too. So we kind of covered everything there, I think. Other tests that we would do would be more, patient specific. So, like geriatric blood work for older dogs and things like that. And, we did a whole segment on geriatric dogs and geriatric wellness. That's not something we would recommend for, like a 3-year-old dog is to, do some additional blood work. But, the older dogs, like we talked about in our previous program, are more prone to things changing, and so just some closer monitoring to those areas is very beneficial.
Okay, is there anything else we need to add to everything we've discussed? Because we've talked about an awful lot of material.
We have. Prevention is key. That's why these 4 things: vaccinations, heartworm testing, flea and tick prevention, and fecal exams. That's why it's all part of the wellness, because all of those things can cause severe disease, but we can prevent all of those things. So why take the risk of dealing with some of these severe diseases if it's so easily preventable?
Okay, I thank you very much.
Yeah.
It was a lot of information. I hope it helps some people. They know now the history of my dog. They know the history of you and getting the rabies, what's it called again? The
titers.
Titer test, so we know that, so
Yeah.
I feel good about you having that. And I think we're good. And I hope everybody enjoyed it. One other quick comment. If anybody comes up with any ideas as to what you'd like to have covered in any of our programs, send me an email or give me a call at the Bark Park, and we will try and include that in our next presentations. Thank you.